Erica, tell us a little more about this study.
Yeah, hey, Chris, good morning. This was a huge study. Researchers looked at more than 150,000 COVID-19 patients, comparing them with more than 10 million others. And they found that after COVID-19 infection, these patients were at increased risk for things like heart failure, heart attack, stroke, even blood clots in the legs and lungs. Now, the majority of these patients came from the VA health system, so they were generally white men, but when researchers dug a little bit deeper and accounted for those factors, they found that the risks remained despite age, race, or even underlying health problems such as obesity. And of course, the concern here is, what is this going to do to our healthcare system? We've already topped 77 million cases here in the U.S. alone. What's more, the pandemic itself also has led to an increase in heart risks overall. People were generally, sedentary, also not following through with their primary care physicians, and doctors have seen a marked increase in things like high blood pressure and out of control diabetes, regardless of whether you've had prior COVID-19. The other thing I really want to point out is that the patients who were infected in this study were all sickened before vaccines were available. And doctors I've talked with who've treated a lot of these patients with heart problems after COVID-19 said that the majority are indeed unvaccinated. So their message is, one of the best things that you can do is get vaccinated, also get back into normal healthcare routine with your doctor. And also, just listen to your body. If your recovery from COVID-19 is stalling perhaps, or you're developing new symptoms, chest pain, shortness of breath, that's a sign of emergency and it's time to call 911. Chris.
So Dr. Patel, you and I talked about this again and again and again. We didn't know what the long-term effects were going to be of COVID, right? And so you see this study and you see a lot of people thousands and thousands who got sick before COVID. Vaccines were available. And then, of course, the people who are unvaccinated. From a doctor's perspective, what would you tell your patients who were COVID positive and particularly had not yet been vaccinated?
Yeah, this data just reinforces what we're telling people every day. Number one, that you don't know about the long-term risks, and it's not just limited to a certain group of people. I think people want to paint this, it's immunocompromised or it's people above the age of 50. That's not true. And this study reinforces what we're seeing clinically. So I would just emphasize that. And then I would just kind of also add in the safety of vaccines. When you really break it down, I think there's just been so much misinformation proliferating about how the vaccines have caused deaths or the vaccines have caused some of these exact things that Erica touched on, heart disorders, blood clots. The truth is that being unvaccinated puts you at a much higher risk, as the VA study showed, relative to people who are vaccinated in that exact same age category. So I do think that this is something we're going to have to keep pushing on. And Chris, we're seeing that the immunity from vaccines decreases over time. We expected that, but it brings up, even for vaccinated people, the importance of boosters. I think people feel like, I got my first series, I'm safe. They are. But we know that having that booster can be an incredibly added benefit to keep them out of the hospital as well.
I also want to ask you another big story. They had a lot of parents talking over the weekend after Pfizer said they're going to wait to ask FDA to approve a vaccine for kids under 5. They say they're doing it out of an abundance of caution, so there's going to be more confidence when the shot is rolled out. But could it have the opposite effect? Are you worried at all about that?
Oh, yes, absolutely, Chris. And my phone was blowing up over the weekend from moms, kind of my age with kids under the age of 5 who asked, why did this happen? And everybody's trying to read into the tea leaves because we don't have a lot of clarity. We don't have the data from the FDA that made them decide to pause that evaluation. Having worked with the agency myself, I can tell you this is not a decision that they came to lightly. But, Chris, this was definitely a botched rollout of communication because you got millions of parents hooked up only to take it away. But I do believe that it was because of, honestly, probably the likely cause was that those first 2 doses in the 2 to 4 age group were just not enough. There were so many cases of Omicron in kids, but we didn't see enough of a difference between those who were vaccinated and those who weren't with just 2 doses, making that 3rd dose even more important. What I would tell and what I have told all those parents, it's hard to get a 2-year-old in a mask, Chris. So I understand the difficulty with that. I've had to deal with it. You really do need to make sure they're around a lot of people who are vaccinated, which we can now do. Even the younger children in your own household, visitors, and the schools they go to. I am encouraging parents to try to get their kids back out for social activities and to try to find some semblance of normal. Hopefully we'll have answers on a vaccine under 5 in the next 6 to 8 weeks. That's cold comfort for those who thought it might come as soon as next week.